Good afternoon, Professor Barry. Very happy to be in this conversation with you. I'm Sylvie Briand. I'm the Director of Global Infectious Hazard Preparedness at WHO. And this department deals with all the dangerous pathogens, so COVID-19, but also influenza, Ebola, Nipah, plague, Zika, MERS, SARS, etc. So we are a group of people really involved in epidemics and pandemic situations. But you wrote a very important book, The Great Influenza, which was published in 2004 and made a lasting impression on policymakers who oversee pandemic planning. As a result, you were invited to testify in front of the US Congress for Pandemic Preparedness for Influenza. And your insights from the book helped George Bush administration map the US pandemic preparedness plan. Most recently, since COVID-19, your book has resurfaced as a source of information. It topped the New York Times book review bestseller lists for 8 weeks starting in June for paperback nonfiction. What does tell you that 15 years after this book was published, we are still coming back to it for insight and lessons, and in fact, how the past can help us to better understand the present. So in the early 2000s, government leaders looked to you and your book to learn about the evolution of the Spanish flu, and for example, how it infected people, how they could use these learnings to prepare for a modern day pandemic. So now we are very interested to know from your experience, how does the situation with COVID-19 today echo learnings from the past century? So do you have some quick thought about this? And then I will ask you more questions about more the communication and all these aspects that are really important for us nowadays.
Well, first, thanks for inviting me. I'm flattered by the interest. There certainly are parallels, quite a few of them, and there are differences, quite a few of them also. Probably the most important parallels are the modes of transmission. They're essentially identical for the two viruses. Most important differences are the virulence and the stresses they're putting on society. In 1918, that virus killed between 50 and 100 million people. If you adjust for population, that would be 220 to 440 million people today. Fortunately, we are not facing anything like that now. This virus is not even close to that kind of lethality, and it's plenty serious. By the same token, the virus in 1918, or all influenza viruses, move much more quickly than this virus. And that means that the stress that society endured in 1918 lasted a much shorter time. There was much greater tragedy in 1918 because of the death toll. And yet, because influenza would move through any particular community in 6 to 10 weeks, and then essentially was gone, and probably 2/3 of the deaths worldwide occurred in a period of 14 or 15 weeks, but again, in each particular community, a shorter period than that, the recovery was quite a bit easier. This virus, the incubation period's a lot longer, probably triple. You're sick longer, you shed virus longer. All these things stretch out the length of time it takes for each generation of the virus. So even if we had not intervened, as almost every country has done, some more successfully and more aggressively than others, but almost everybody has done something. Even if we had not intervened to slow transmission, which stretches things out even longer, there would have been a much longer period of time under which we were facing the economic consequences of this virus. You know, most countries did intervene, and that has lengthened the time under which the stress is placed upon us. I think without a doubt, that was the right thing to do. I think the death toll would have been unacceptable. Otherwise, it would have been vastly greater than it's likely to be. But the economic stress has been greater and harder to deal with than the much more intense period of 1918. There was a fairly steep recession in 1918, but recovery was considerably more rapid.
And so also in 1918, I mean, the world was at the end of the First World War. So how this context, I mean, impacted, in your opinion, the not only the death toll, but also, I mean, maybe the spread or the impact of the virus?
You know, I really don't think the war had much impact on either of those things. You look at the larger, you know, a broader view, perspective, you know, the vast majority of deaths was outside Western Europe, in countries that were not at war. I mean, India was at war, and India suffered terribly, but in the pandemic. But again, that was unrelated to World War I. You know, you had influenza pandemics that managed to cross the Atlantic Ocean in 1698 by sail. So you could get in 1889, before air travel, it was pretty much worldwide, a pandemic. So you could get around the world without airplanes and without the war. So I don't think the war had much impact. There's a theory, which I think there is no evidence for really, but there's a theory advanced by evolutionary biologists that the close contact of soldiers in trenches allowed a virulent form of the virus to mutate and to take hold. I think that's frankly nonsense. And I don't want to waste time going into why.
Yeah, but I've heard also another theory on this, that maybe also young soldiers who died from flu, they didn't want to be seen as a victim of flu. They prefer to die, I mean, be seen as dying as hero of the war. And so do you think this is a theory that makes sense, or I mean, that could have also hidden a certain number of deaths and were attributed to the war instead to be attributed to flu?
Well, I mean, I'm sure that's true, that if you were in the middle of a war and you were going to die anyway, you would rather die as a hero than as some kind of accidental casualty. That war it's certainly one of, if probably the most pointless wars ever fought, with death tolls that were astronomical, single battles with hundreds of thousands of people killed on both sides, just extraordinary. You know, again, we're limited for time, so I won't elaborate.
No, I think one point that's very important for us to better understand, also looking at the past, is because currently what we see with COVID-19 pandemic is really a growing mistrust. Mistrust in the science, mistrust in expertise, mistrust sometimes in governments, and mistrust on interventions as well. Was there a similar mistrust during the 1918 pandemic, or is it very specific for our modern world?
Well, the United States, which I know best, certainly there was every reason to distrust the government because the government was telling outright lies. The disease was known as Spanish flu. although it didn't start in Spain. There are various theories as to where it did start, but we know it wasn't Spain. And American public health authorities, national public health authorities, were saying this is ordinary influenza by another name. But people very rapidly learned this was not ordinary influenza. You know, given the fact that some of the symptoms were truly horrific, where we have good data from some military camps, 15% of the patients had nosebleed, and some people were bleeding from their eyes and ears, not just their nose and mouth. That's a pretty terrifying symptom. Others were turning so dark blue from lack of oxygen. In my book, I recount one physician writing a colleague that he couldn't tell African-American soldiers from white soldiers because the cyanosis was so intense. Of course, that spreads rumors of the Black Death of the Middle Ages. And in fact, so when the government is saying this is ordinary influenza by another name, and people are experiencing, you know, those symptoms, or you're seeing their neighbor, their spouse, the kid down the street, they know they're being lied to. So the impact of that was people simply stopped believing anything they were being told. It did not reassure. I don't think anyone was reassured. When you know you're being lied to, you trust no one. You're forced to rely upon yourself and your family. And that's very alienating. I think in most societies and in most crises and natural disasters, people tend to come together, the best of humanity. I mean, during the tsunami a few years ago, the Civil War essentially stopped. The Tamil Tigers, you know, worked together to try to save people's lives. And I live in New Orleans, Hurricane Katrina 15 years ago. People were certainly trying to help each other then, even at the risk of their lives. In 1918, there were certainly heroes, but there was also a tremendous sense of alienation and fear that there was plenty of reason to fear, but the fear was exacerbated by the lies people being told, with the result that in some places you see reports of people starving to death because everyone in the family is sick, and neighbors, and in some cases even family members, even a sister in one Red Cross report, was too frightened to bring food to that family. There was plenty of food, they just didn't have any. So they were starving. And you saw reports of that not only in big cities in the United States, but in rural areas where you would have expected, you know, family and community ties to be much more important. And there's almost a control situation. Most cities, the public health authorities lied. But in San Francisco, the mayor, the public health authorities, the business community, trade unions, leadership, they all signed a joint statement published in the newspapers in huge print that said, wear a mask and save your life. Now, this is a very, very different message than this is ordinary influenza by another name. And San Francisco suffered pretty badly. They were the fourth or fifth hardest hit city in the country and the hardest hit city on the West Coast. But as a society, it functioned. People didn't starve to death in San Francisco because no one had the courage to bring them food. They were very well organized. In Philadelphia, by contrast, when the head of a volunteer effort repeatedly issued pleas for volunteers to come forward, nobody was coming forward. In San Francisco, when they closed schools, teachers were volunteering even to drive ambulances, which is, of course, a high-risk occupation. So I think ultimately society is based on trust.
Mhm.
When trust breaks down, society begins to fray. And to a certain extent, that certainly began to happen in 1918. You know, so far in COVID-19, the situation's quite a bit different. The lethality of the virus is less. There's certainly plenty of dread out there. It's not the kind of panic that occurred in 1918. In some countries, the messaging has been very, very, to say, mixed at best. And I think it's hindered the response. And the United States and Brazil are probably the two best examples of that. But no doubt they're not the only examples.
So, but what I hear from you is that actually sometimes governments, because they want maybe to reassure the population or reassure themselves, I don't know, they tend to portray the reality differently. And so your advice would be really to give the facts as they are and foster the data, the presentation of the data so that people can take action. Does it reflect
Right.
currently your what you learned from this 1919 pandemic?
Yeah, I think the two biggest lessons from 1918 are, number one, and this is the most important one, tell the truth. I think people can deal with the truth. And if you ever want the public to comply with your recommendations, they have to trust you. And if you don't tell them the truth, they are not going to trust you. The second lesson from 1918 is that non-pharmaceutical interventions can work, but we no longer need that as a lesson from 1918. We can look around us at what various countries have done this time around, and they have, you know, some countries have been far more successful than I ever would have imagined would have been possible, strictly using so-called non-pharmaceutical interventions, you know, public health measures.
So now I would like to just look at another angle of this communication during crisis. You know that the media are really important for spreading the information. Do you see how was the role of the media in that time, and do you see some comparison with what is happening now that we have the TV and many different media?
Well, you know, there were rumors in 1918, you know, there were certainly social media makes communication of information, good and bad, much easier. And it is different, but by the same token, human nature is the same. And there are always people who are going to believe rumor or spread rumor, even though it's maybe completely, utterly false. And there was rumor in 1918. You know, for example, I mentioned earlier that cyanosis was so intense that some physicians couldn't distinguish African Americans from Caucasians. In fact, a U.S. military intelligence report from Switzerland in July, which was the first, in August, I guess, which was the first place in the world with widespread second wave when the virus became virulent. The U.S. military intelligence reported that this is being called influenza, but it's actually the Black Death of the Middle Ages. And that was because of the cyanosis. And it was, of course, influenza. So when you have things like that happening, then you got rumors spreading widely in 1918. Now, of course, you know, the spread is wider. And that is why telling the truth is more important than ever. If you are going to maintain trust and get any kind of compliance with recommendations, you have to be ahead of the curve and aggressive. I think, and I've been in meetings with politicians during I was part of the Bush administration's planning process to create a preparedness plan for a pandemic. And I've been in many other meetings as well. When someone would say, well, we don't want to scare anybody. If that is your approach, then you are going to be behind the curve. If you want to be so cautious before you make a statement, then the social media is going to outrun you. And you will have already lost the battle, and you will be fighting to maintain your credibility. So don't hold back on the truth. That's my strong advice. That doesn't mean that if you really don't know something, that you should go out on a limb. No. But what you should say is, we don't know. And this is why we don't know. And this is when we will know, and this is why we will know it then, but we don't know it now. Let's say there's a series of tests in the lab that have to, that take a certain amount of time and have to be done sequentially and can't be done simultaneously. That'll give you a time frame of hours and say, we're running this. So don't just say, well, we're not, give out all the information. Don't hold back. I am familiar with the term, quote, risk communication, unquote. And sometimes I've been told give advice on risk communication, but I don't like that phrase, because that implies managing the truth. And you don't manage the truth, you tell the truth. So obviously I feel pretty strongly about that.
Yeah, thanks a lot. And to make this difference, I think, but also, we have seen recently that people tend to say that rumors spread faster than the truth, than the right information. Have you seen this as well, or is it just a bias, a cognitive bias, that we think that misinformation is more visible than the right information?
Yeah, it's that a rumor will go around the world twice while the truth is trying to get out the front door. I think there's a certain accuracy to that. It's obviously a problem because people can spread rumor with no concrete data to base on whatsoever of any kind, and even if you're as forthright as you can possibly be with the truth, you still want to have the data that you are basing your comment upon. And it does make it harder. It just means you have to fight harder to get out your message. But if you are established as a credible source, people are going to look to you. Here in the United States, I don't know how closely you follow it, but you have a president who has actively attacked Tony Fauci, who is the head of the National Institute of Allergies and Infectious Disease. And yet Fauci has retained his credibility to a very large extent. Polling shows that he is considered much more credible than anybody else in the administration. And that's because he sticks to what he knows and he tells people what he honestly believes based on real data. He's not trying to manipulate them. Over a period of time, I think that will show itself to be the case for whoever is doing it and will bear benefits.
So your advice is really stick to the truth, whatever happens. Don't try to counter misinformation, but just follow your line and stick to it. Is this something that you can take from this?
I mean, you might try to counter the information. I'm using the risk communication that I already deplored somewhat, but there is some science to that, and you have to be careful because sometimes in repeating misinformation, you actually, simply by repeating it, give it more credibility. So you have to be very careful if you are actually trying to rebut something that's not true. You have to make sure that when you mention the untruth, that it is sandwiched very carefully between what is true. I think that's well established, by psychologists and others who study communication.
Yeah. So in this pandemic or COVID-19 pandemic, we have seen also difficulties for experts to be heard. And you mentioned the case of Tony Fauci. He is very known around the world and listened to, but in other places, it seems that expertise has really been undermined and not really believed in and so on. So were there similar phenomena in the 1918 or experts were really really high and really well trusted?
Well, I'm sure I didn't quite catch what the actual question is.
Okay, so currently we see that there is a lot of criticism about expertise. An expert.
Right,
there are lots of experts everywhere, and people are not sure if they can trust experts or not. And so the question is, from my side, is it a new phenomenon, or was it also the case in 1918?
Well, it's hard to say because in 1918, almost no one was publicly disputing the line that was coming out of the national government. There were actually laws in place that made it punishable by 20 years in jail in the United States for criticizing the government. It's an oversimplification, but not by much. When one newspaper in the US started to print the truth about the pandemic, they were actually prosecuted under that law, although the prosecution was dropped as the pandemic proceeded. So there was no one in 1918 really playing the role of Tony Fauci nationally. There were in some local cases, and it wasn't a battle of experts. So that's not really a precedent for what we're seeing today. There is, in the United States anyway, a long history of anti-intellectualism. And that always plays a role. But it's not like today, I don't think. Yeah. Here you have politicians actively undermining experts. So it has become, in some countries, political football.
Yeah. And do you think, maybe now also experts are talking directly to the public through the media. Do you see, is there any advice you can give to those experts on how to talk to the public? Because maybe this is also a reason why some of them are not trusted or not from what you see in the US, for instance. Is there a way to talk to the public that works better than others?
Well, I think you have to be yourself. I think people can see through a show. Don't condescend. People are smarter than you think they are. If you can explain something without condescending, that's helpful. but primarily be yourself. And also, I think it is incumbent upon public health leaders to find someone who naturally is both reassuring and trustworthy. Going back actually almost 20 years, not quite, I guess 15 years, when we were sitting around in the Bush administration, when they were setting up the pandemic preparedness plans, we were debating, what kind of spokesperson would be best to carry the message, because again, in any public health setting, the delivery of the message is absolutely crucial to your success. And we were pretty much unanimous that no politician should be the spokesperson, because no matter how trusted that politician was by a majority of the electorate and the public, there was going to be a significant percentage of people who wouldn't believe anything they said, or at least they would be inclined to disbelief and discredit anything that the politician said. That would go not just for Trump, but it would be true for Obama, although or Biden or anybody who would be a different part of the audience, of course, that would not grant him credibility. That also applied to in the U.S. the Secretary of Health and Human Services, or the Minister of Health and any other because they also were viewed as political figures. And oddly enough, although Tony Fauci was not a party of any of this planning exercises, we were unanimous that if there were a pandemic right then, we wouldn't want Tony Fauci to be the person who is the public face. So I think there should be some consideration in choosing who the lead spokesperson was. And you also would like to have one or at most two, and maybe in some cases three, but they all have to give the same message, and the fewer, the better. So, there is some thought that you have to give to how this is presented and who the presenter is.
Yeah, absolutely. Yeah, I think it's very important. We see this. I mean, it's a very important point. You talked previously about how the 1918 pandemic spread and have localized outbreaks. Is there any also advice you can or lessons you can draw from a previous pandemic about how to engage communities, empower communities to take care of their outbreak? You mentioned San Francisco and so on, but also now we are in a globalized world, so we have different small communities here and there. And so have you had any lessons about how to work at a more local level and how to manage this communication at a more local level as well?
Well, I think not so much from the 1918 pandemic. There was I wrote another book about a flood on the Mississippi River in 1927. And there are lessons from that. I mean, this was the greatest flood in American history by a wide margin. The Mississippi River runs, for several thousand miles. There were, and the basin stretches, all are part of 31 states of the United States. So there were floods from Virginia all the way to Oklahoma. People were killed. And as you got closer to the Mississippi River itself, these were all on tributaries. It got worse. And then on the lower part of the river, you had almost 1% of the entire population of the United States ended up being fed by the Red Cross in communities all along the course of the river. And that was actually handled very well. And one of the reasons was they centralized purchasing, but decentralized the administration. They gave local authorities in each community a considerable amount of power over distribution, thinking that they knew the situation much better than any national authority could. I think that's probably a pretty good lesson, at least in the immediate aftermath of some disaster. You know, certainly you need the resources from a national, and then depending on the disaster, in some cases, an international community. And you do need oversight. But, you know, I think listening to someone who's on the ground and giving those on the ground real authority as a general rule is pretty helpful.
Absolutely, yeah. So my last question would be more now to go to the international level. The pandemic is an epidemic that affects many countries in the world. And we have seen that it can be, communication can be very challenging in one given country. But now what is your view currently about the overall communication during the COVID-19 pandemic at global level? What challenges are there now? We are, we call it a globalized world where we have a lot of economic exchanges, but people see that in fact, the pandemic is unfolding very differently in different places. That the spread is very different in Asia compared to America, and so how do you see this from with your experience of previous pandemic? I mean, how can we manage these new challenges? Being that the fact that we can communicate about everything, we have news from everywhere at the same time. How can we have a cohesive picture of what is going on?
Well, 1918 is not a precedent for that. I don't think there was even an attempt to communicate globally in 1918. I don't think there was much of an attempt in 1889. I looked a little bit at 1889 as well. I'm trying to think back to events then. And my memory on 1889 is not nearly as good, and I didn't look at it nearly as deeply, but neither of them are precedents. Certainly not 1918. And I think most people are concerned with their own community and their own country. I think there certainly is a role of leadership that, for example, WHO, number one, can provide. WHO, of course, has also been a whipping boy in a couple of places. And I'm not sure that I see a solution there. We're not at a point where any individual country's leader really, or at least not in the developed world, is looking, and probably nowhere, is looking to global leadership first. I think there's an important role, but it's more behind the scenes, because every country's leadership is going to take or leave what it wants from the WHO. It can give its guidance and should, but it's really going to come down to the individual countries.
Yeah, I agree with you. And I have just another question that came to my mind. You know, in 1968, there was also a flu pandemic. And
right.
Surprisingly,
and 57 as well.
Yeah, 57. But the 1968, what I learned is that it was nearly absent in terms of communication. I mean, people went through it, at least in Europe, and most of the people have forgotten. Although there was 2 million deaths, at least, but it was as if it was not very important. And I knew that at the same time in the US there was this other things happening, like the Vietnam War. In Europe there was a lot of social movement in France. Yeah, for instance. So do you think that sometimes social events are more important than health events, or what could be the balance, I mean, between those two things? Because in 1918 there was also this First World War, so very important social event, but still the pandemic was very important in the communication. So is it because of the severity of the disease, or do you understand certain factors around it?
I think the virulence of the virus, the lethality, is really going to be the determinant there. You know, if this virus were more lethal, and if it tended to strike a younger cohort, I mean, 1918, the peak age for death was 28. You know, the overwhelming majority of the deaths 18 to 45 years old. You know, there would have been none or very little of the pushback that we've seen in terms of closings. You know, so everything is, you know, a function of all sorts of factors, as you just laid out. You know, in 1968 in the U.S., Vietnam, and civil rights, and you know, Europe was also in much of an uproar, and that 1968 pandemic was, you know, it just wasn't that deadly. Plus, it's influenza, and influenza is something people are familiar with, so they have less fear unless they're given a reason to fear. You know, I don't really recall much publicity about the 1968 pandemic at the time. Perhaps even more surprising would have been the 1957 pandemic. Again, only 40 years after 1918, so you had an enormous number of people alive who had experienced the 1918 pandemic. But on the other hand, in 1976, in the US, you had a pandemic that never happened. There was only 1 or 2 soldiers died of so-called swine flu, but it was the same virus, or it was an H1N1 virus, wasn't identical, but they were both H1N1 viruses as the 1918 virus. And you had this enormous concern in the United States and a huge vaccine effort and so forth, and so, which ended up being not entirely a disaster, but unnecessary, and probably cost Gerald Ford the presidency. I think the two factors really are the intensity of what the distraction is and the lethality of the disease. And they're both sort of balanced on a continuum. You could have high intensity and a highly lethal virus, and you get 1918, where you had the war and you had the virus. You could have, you know, well, I've already said pretty much. I could keep mumbling, but.
No, but I think it's very important as well, in what you say about the fact that it's unusual death as well, because I think for elderly, if they die, I mean, it's part of the normal course of life. When you are very old, you tend to die in any case. But in fact, when it affects young adults, or especially when they are all otherwise healthy and are not supposed to die, and or if it affects children, for instance, people think that this is not natural, this is not normal. and something. And so the virulence is not only about the absolute number of deaths, but it's also how it is, how far it is from what we think it's normal or not. And I think this is a very important point that
I think now novelty is a factor.
Yes.
You know, again, I know much more about the US than elsewhere, but in the early 2000s, we had West Nile virus in the United States. West Nile virus was never going to be a serious threat to human health. It never killed as many as 300 Americans, never. Influenza has never killed less than thousands, and in some cases, 50, 60,000 a year in the United States. And yet, until H5N1 surfaced, the US government was spending more money researching West Nile than it was spending on influenza. Totally irrational. But the fact that it had this name, West Nile, coming out of Africa, it was more frightening to people. Again, irrational. So, and that was never properly messaged by the US public health community. In fact, I remember watching a national Sunday talk show when the head of the CDC was asked, is this an epidemic? And the response was yes. And I remember getting very upset over that. In a technical sense, yes, it was an epidemic technically.
Mm-hmm.
But again, it never killed more than 300 Americans in a year. So by saying on, I think the show was, I mean, it was one of the major Sunday talk shows, by saying that on national television, you elevated the level of fear and attention way out of the ordinary.
Yeah.
And, in one sense, I'm contradicting what I said earlier about telling the truth, because yeah, it was the truth. Technically, it's an epidemic, but it should have been a message that it should have been a very different message.
Yes, no, I think it's, the issue is that the population perceives a certain situation, and so we need to adapt the way we present the situation to what is perceived also out there, because otherwise there is a disconnect basically between what experts say and what the population perceives. So we need to align somehow this.
Yeah.
Do you agree with that? Yeah.
Yeah.
So if we just to conclude, and thanks a lot really for your marvelous insight, and it's so delightful to hear about the past and how the past can inform our present and probably the future. From all your experience now, if you were to advise some young people ready to communicate about those crises and try to improve the communication, would you have a set of advice for them so that we can use your advice?
I don't know. Nothing that I haven't already said. Number one, tell the truth. Maybe thinking to what we were just discussing about West Nile, I might add to make sure put it in context. Don't look for false reassurance, or don't even try, provide information. Truthful information and all the information. Don't hold back, and if you're, for example, at a press conference, just keep answering questions until there aren't any more questions. Bore the media with data. And people will eventually figure out that you are a good source for information and that you are not going to mislead them, and they will come to you. I hope.
Thanks a lot. It was really, really interesting. And thanks very much for your time you dedicated to this interview. And I'm sure it will be a very important piece for our young new infodemic managers so that they can learn from this. So thanks a lot.
Okay, thank you.